Dr. Kevin Michaels says his path to his medical career began as a second lieutenant in the Army after graduating from college in an ROTC program.
I went on to graduate school at the University of Alabama, Birmingham School of Public Health, got my MPH within 9 months I got my MPH and reapplied to medical school and got accepted into South Alabama.
MPH is Master of Public Health and the basis for the job he has now as Mobile County Health Officer.
I was engaged by a mentor in the military who reached out to me and said, hey, here you got your MPH. Are you interested in doing public health? And it was sort of this advertisement. This is well before the internet and email. I got this pamphlet telling me about all these great things that what I can do as a public health physician. And I said, that's what I want to do.
Yeah. He took over from Dr. Bernard Eicholt, who retired after 31 years and who also has a military background. Michaels, a New York native, says he first met Eicholt as a medical student at South, which eventually led to him returning to Mobile after a 24-year military career.
When I was in medical school, I thought, well, hey, what do I want to do when I get out of, when I'm done with the military? And one of the things is maybe come back to South Alabama and work at the health department.
Now, as health officer, Michaels joins a long line of former health officers who all had military experience, including Eicholt. In fact, many health department employees today also have military backgrounds. I wondered if the track to a medical career in the military is different from a civilian one.
They meet the same training requirements. Whether you do it in the military or the civilian, you have to sit for the same civilian boards.
One key difference is on the military track, the training is paid for, although there is a requirement for active duty service for a number of years. Michaels was obligated to 8 years, although he stayed longer. Today, he has a daughter and son serving in the Army and another son pursuing a medical career in the Air Force.
And then when he opted to go to medical school, I told him, hey, listen, you got to find somebody else who's going to pay for, consider somebody else to pay for medical school because it's costly.
And Michaels continues his public service as health officer for Mobile County, and it's why we're proud to recognize him for serving those who serve. Bill Riles, WKRG News 5.